August is GastroParesis Awareness Month. Gastro means stomach, and paresis means paralyzed. Please remember, I am not a medical professional, and I am simply raising awareness of this condition. It is a long-lasting and chronic disorder which is a problem with the stomach emptying food into the small bowel. Importantly, there is no physical obstruction to the flow of food. Instead, there is a problem with the nerves that line the stomach, which means the nerves are unable to push food down the stomach and through the gut. It can affect people of all ages, but it is common in women and also adults, and in adults diabetes is the common cause of it. This is because the high blood sugar levels in people with diabetes can damage the nerves that line the gut. GastroParesis can be caused by problems that affect the brain and spinal cord, such as multiple sclerosis or Parkinson's disease. People are labeled with having idiopathic gastroparesis when the cause is unknown. There is evidence that people with the connective tissue disorder hypermobile Ehlers-Danlos syndrome are at increased risk of gastroparesis compared to people without hypermobile Ehlers-Danlos syndrome. Symptoms of it are like trying to flush a blocked toilet. There will be a backlog of food, and this will naturally result in feeling sick and being sick, tummy pain and belching. Accurate diagnosis of gastroparesis is the cornerstone of management. 1 is to try to get a gastroscopy, which is a camera test that visualizes the inside of your stomach, which is required to see if there is any physical obstruction to the flow of food through the stomach. 2. Gastric emptying test may be used. This is when a person eats food that contains radioactive isotope. The passage of the substance through the stomach is monitored by lots of different scanners. And that way they can measure how quickly the tummy is emptying of food. Some basic dietary advice is recommended. Chewing food slowly and more thoroughly makes it easier for the tummy to digest it. Having smaller, more often meals throughout a day as opposed to 2 or 3 large meals can be very helpful. People should avoid carbonated drinks, such as lemonade or Fanta. Anti-sickness medication, such as metoclopramide, are effective because they increase the speed within the stomach empties, but these medications should only be taken on the advice of a qualified medical doctor. I am not a qualified medical professional. In some special cases, people who are severely malnourished or have debilitating symptoms of gastroparesis, an artificial feeding tube can be implanted in the body, which is where a plastic tube is passed through the nose via the throat into the stomach.